My name's Sullivan Ayuso. I am a general surgeon who specializes primarily in abdominal wall hernia surgery, and I'm an assistant professor at Dell Medical School. So my patients are those primarily with abdominal wall pathology, so hernias that are at prior incisions, people with growing hernias at their belly button, people that have had hernias develop as a result of trauma. I also treat disorders of the stomach and the esophagus, such as people who have reflux disease, people who have esophageal motility disorders such as achalasia, and those with obesity. So I think surgery in general allowed me to be a complete doctor. I was able to diagnose disease and then also treat critically ill patients and then operate. And so that really gave me the entire spectrum of being able to take care of somebody. In terms of hernia surgery and minimally invasive surgery, I think this real focus is on quality of life and improving patients' quality of life. And so there's a lot of reward for seeing somebody come into your clinic who is somewhat debilitated from their condition, and then seeing them at their post-operative appointment and knowing that they're doing well and getting back to the things that they want to do. I want my patients to know that first and foremost, my priority to them is listening. I want to know, what their symptoms are, what's bothering them, and how can I improve, what they're coming to the clinic to see me with. Sometimes that's operating on them, sometimes that's no operation at all, and I want to match my plan of care to whatever it is that their desire is to improve upon. So for me, working at UT Health Austin is really a dream job. I was born in Central Texas, and this is home for me. I feel very connected not only to the place, but the people here and the patients that we see in the clinic. Another thing that drew me to UT Health Austin specifically is the team-based approach to care. At UT Health Austin, there are a lot of folks who are very team-oriented in their approach to taking care of patients, and I think that just makes a good work environment and ultimately allows us to deliver the highest quality of care to the patients.